So there is a war within chiropractic, and I'm going to give you the inside scoop. There's some drama here. So let's just call it what it is. There's a big battle, and this is all about some words. So the words are bone out of place. There's a bone out of place model in chiropractic, and bone out of place, we call it the BOOP model, right? One side is subluxation based, meaning we believe in these small spinal misalignments or fixations. And those affect the nervous system, right? They can affect organ function, they can affect behavior in kids, they can affect bowel movements, they can affect all sorts of things, and obviously pain, right? Headaches, those sorts of things. That's subluxation. There's another side that is more physical therapy, rehab focused, evidence based, quote unquote. That's quite a buzzword right now. They reject subluxation as pseudoscience. So there's even ridiculous things like chiropractors who claim chiropractic is pseudoscience and witchcraft and things like that, anti-chiropractic chiropractors, which is a silly concept. I don't know any anti-surgery surgeons, but anyway, I'm going to explain this whole thing to you, okay? And it's actually quite interesting. So this debate exists because there was, in the early days of chiropractic, an idea that a bone pinches a nerve and that will cause disease, right? Now, that is not anatomically true most of the time. If you have a bone that is physically pinching a nerve, that's going to cause pain, yes, but that's also going to cause numbness and tingling. It's going to cause weakness and things like that. Most times when you feel like your neck is tight or you're getting headaches and things like that, those are not bones physically pinching nerves, okay? Those are, in my world of a subluxation-based chiropractor, those are from misalignments, right? And we'll get into that. So modern research shifted language from subluxation to joint restriction or fixation, right? It's talking about stiff joints that aren't moving properly, but they reject the fact that there can be a misalignment. Okay. So we've all had maybe like a stiff neck or something, but some of us have had things that feel out, right? And a lot of people say, oh, my back's out or my neck is out. And they're insinuating or they're implying that there's like a misalignment. Something's not in proper alignment in the spine, right? And this whole rehab-based chiropractic philosophy rejects that outright. So this is a fight about words because subluxation chiropractors do not reject that joints are restricted. That's actually part of our philosophy. But there's another part of it that there can be actually a misalignment, right? A vertebrae can be rotated a little bit and stuck there. And it doesn't quite make sense to me why the other chiropractors, the other side of this debate, rejects that. So let's talk about the words. The word is, and it's often called the S word in chiropractic, it's subluxation, right? What is subluxation? Well, subluxation, let's talk about what it's not. It's not a dislocation. It's not some big giant shift of a bony landmark or a vertebrae. It's a tiny micro shift or a rotation, okay, or even a tilt. So it's actually kind of interesting. The word subluxation has two meanings, really. One meaning is more of a literal translation from Latin, and sub is less than, right? So sub-zero is less than zero, but subluxation is less than a dislocation, okay? Luxation or lux, I can't remember the full root word of it, but the translation is less than a dislocation. Subluxation, right? A misalignment. Partial dislocation is sometimes what it's referred to as, but the other translation is interesting, and I like this one. It's less than, which is the sub part, and then lux in Latin means light. So it's less light, which is cool because like our nervous system, our brain and our nerves, like they're delivering electricity, right? Those neural impulses. We're basically saying that there's less light in our bodies, in our systems when there's this interference that is stopping or interfering with or interrupting the full flow of this information, right? And that's where we get some of these issues like digestive issues and behavior issues and headaches and brain fog and fatigue and all sorts of things. So what are we talking about? We're talking about, like I said, a tiny shift, a micro shift, a tiny rotation, maybe a couple of degrees or a couple of millimeters off. It's not typically something you're going to find on an x-ray. It's something that you can feel, but it's not going to show up necessarily on an x-ray or an MRI. Plus, they're not looking for that. Most of these radiologists they're not even trained, or they don't even know how to measure these things, right? Plus, each vertebrae has its own position You'd have to measure each individual vertebrae and the very detailed nuances of their positions and where they should be and where they are. And so there's a notion in chiropractic that there is research disproving the BOOP model. There's research disproving the bone out of place model of chiropractic, and that is not true. I have looked at every study I can find, and not a single study says what they say it says. Let me just share an example with you. There's a study that they looked at patients with low back pain, and they took before and after MRIs of the joints in the low back, and they determined that when you adjust low back, you actually gap some of the joints a little bit. They found this on MRI. They said it's a temporary gapping, but they do gap. There's extra space in there. The study says nothing about misalignments or rotations out of place or anything like that. There's no measurements given. The study doesn't aim to assess that. It's a low back pain study to see if chiropractic works. And it actually says that, well, yeah, chiropractic actually did gap these joints in the back of the spine. So studies that are quoted or referenced when they're trying to disprove this model don't actually say anything about that. If you're going to do that, you need a study that says, here's a person with a misalignment, right? We found the misalignment on X-ray, on MRI, on something, and then you adjust it, but the misalignment's still there, right? That would just mean there's probably just an anatomical thing. Like their anatomy is just kind of wonky there, and therefore there's no true misalignment. It's just an anatomical variation. But there's no study that does that. There's no study that I found that looks at a misalignment or a suspected misalignment, and then you adjust it, and then it's gone or it's still there. Doesn't exist. So these chiropractors that are referencing studies to prove or disprove the bone out of place model, it's just nonsense. It really is. There is a dismissal of the rotation, like I mentioned. They claim that there are joint restrictions because of tight muscles. Okay, so the idea is that this joint, wherever it might be, gets restricted for some reason, or fixated, or inflamed, or whatever you're looking at there, and therefore the muscles around the joint will get tight, and they will cause that joint to not move even more. And that is what we're adjusting. We're adjusting joint restrictions and not misalignments. And I'm saying, yes, that's part of it, right? I'm not dismissing that. They're dismissing the misalignment part. This idea of maybe tight muscles causing the restriction is a very simplistic view of it because they're assuming muscles can't get tight asymmetrically, right? You have muscles on both sides of your back that attach to both sides of your vertebrae, and who's to say that they are going to contract at the exact same amount, right? The same level. I don't know about you, but I've woken up in the morning and one side of my neck can be tight and the other side can be just fine. That's not weird. That's not an odd concept, right? That's a very typical, common thing in life where one side is asymmetrically tighter than the other side. Well, if that's true, some of these muscles attach to the vertebrae. So if one muscle on one side is tighter and it's pulling on the vertebrae, doesn't that make sense that the vertebrae would be misaligned? So the whole idea of dismissing this half of chiropractic, the half that chiropractic was founded on, seems a little ridiculous to me. So why does this matter for the nervous system? This is not about bones crushing or pushing or smashing nerves or pinching nerves. It's about how joint movement feeds signals to your brain, right? This is all nervous system. It's all nervous system related. None of this is purely about muscles or soft tissues or joints or bones. This is about the nervous system and how it works. When you have tight muscles, that comes from nerves. You have nerves within your muscles. Some of those are called muscle spindles or Golgi tendon organs. Different nerve endings are in the muscles and tell them to be tight or tell them how much tone they need. And so if you have a joint restriction, that's going to send a lack of signal to your brain. And that can register as pain. It can register as other things too, some lack of function. So we want to restore that, right? But we can restore that whether it's a joint restriction or a joint misalignment, if something is physically out of line. And you can feel this. This is the part that really gets me is I asked a presenter at a seminar that I attended because he was on the train of dismissing the bone out of place model. And he was one that referenced some of these studies. And so I asked him after the presentation, I said, hey, man, I've felt misalignments before, especially in the neck. Like it's very easy to feel if you have like a C2 that's rotated out of place. You can feel that. Like, what are you saying exactly? And he basically told me it's just in your head. You're not actually feeling that. It's just a joint restriction. It's a fixation. I mean, I can feel a stiff joint. Stiff joints are easy to feel, but when you actually feel a physical bone rotated a little bit, that's a pretty obvious thing. And so I basically was gaslit is how it felt. And I was told that it's just in my head, and it's ridiculous. Like, I'm not looking for this thing. I'm not like proving to myself that it's there by thinking it into existence. Like, I'm looking for things that are wrong. And sometimes you find a misalignment where there's a rotation, right? I'm not looking for it. I'm not looking for a misalignment. I'm looking for a problem, and I find the misalignment. So it's, it's easy to get frustrated. So again, this is about the nervous system. These misalignments are stress in the nervous system. They prevent the nerves from functioning properly. And whatever that nerve does downstream, that thing will suffer. Okay. And like I said, that can cause a whole host of different issues. I specialize with kids and pregnancy and families. So I see a lot of different things besides just low back pain and joint restriction and muscle tension. I see behavior problems. I see ADHD. I see OCD. I see asthma and allergies and constipation and all sorts of things. And I've seen every single one of those things improve when the patient is under regular chiropractic care. And what does that mean? That means that we're affecting the nervous system, because the nervous system controls those things. It's not just about muscles. It's not just about soft tissues. So I guess my whole point in this, to wrap up, is I just want to hold true to what's true. Like, I don't want to dilute or diminish what chiropractic is, right? Because it seems silly to me to try and remove these things from chiropractic that makes it what it is. It's not outdated. The boot model is not outdated. It's not disproven. It's not even close. It just hasn't been looked at from a research standpoint appropriately, which is kind of crazy. I think that would be a priority when you're trying to disprove something, is to set up a study to disprove it, but that study's never been done. Instead, people just claim it's been done, and they reference studies that look at other things and don't look at the thing that they say it's looking at. Anyway, my invitation for you is, found this interesting, share it. We need to get the word out to other chiropractors who are under the assumption that the bone out of place model is not a thing. And so when you say that my back feels like it's out, they're not just rolling their eyes, when they walk out of the room. That's a real thing. Your back might be out. It might be misaligned. There may be vertebrae that are rotated slightly out of place or in some sort of position they're not supposed to be in. And so I want you to receive the care that you need. And the best way to do that is to spread the word here. And obviously, if you're local to Logan, Utah, come into my practice and we'll get you or your kids feeling better with whatever you may be dealing with. So hope you enjoyed. Catch you next time.